Welcome to the Maternity Mentor. Today we will be talking about carpal tunnel syndrome and how to treat it quickly so you can get back to normal. Stay with us. Hi, I'm Samantha. I'm a board-certified nurse practitioner, and I have over 12 years nursing experience working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Over 60% of women may develop carpal tunnel syndrome during their pregnancy. Most women will experience mild symptoms, but for approximately 10% of women, it will be painful and interfere with daily life. Let's explore what carpal tunnel syndrome is and how to treat it. Nerves are located throughout your body. Their job is to send signals from your body to your brain, as well as from your brain to your body. Carpal tunnel syndrome is a disease that affects your median nerve, which is a nerve located in your wrist. The median nerve comes down from your arm into the hand. To get there, it passes through the carpal tunnel space, which is a narrow area in the wrist. This space is made up of ligaments and small hand bones called carpal bones. If anything presses on your median nerve as it passes through the carpal tunnel space, you can develop carpal tunnel syndrome. Carpal tunnel syndrome can be caused by some of the physical and hormonal changes that take place during pregnancy. These changes can cause swelling and fluid retention, which can place pressure on the carpal tunnel space and median nerve. Some pregnancy-related causes of carpal tunnel syndrome include water retention or edema, hypertension or high blood pressure causing edema, gestational diabetes, excessive weight gain, and being pregnant with more than one baby, like twins or triplets. There are also some non-pregnancy causes of carpal tunnel syndrome, including rheumatoid arthritis, injury to the wrist, and repetitive hand movements like typing on a computer, which is perhaps the most common cause. Risk factors for developing carpal tunnel syndrome include being overweight or obese, and being a first-time mom over 30 years old at the end of pregnancy. Unfortunately, your chances are higher of having carpal tunnel syndrome again during pregnancy once you have had it once. Carpal tunnel syndrome most commonly starts in the second or third trimester. However, it can start at any time. Symptoms of carpal tunnel syndrome include feeling like your hand is falling asleep, numbness in your thumb, pointer, or middle fingers, numbness in the hand near the thumb, a burning sensation in the arm or hand, wrist and fingers feeling swollen, clumsiness with your hands, weakness when grabbing objects, dropping things, pins and needles feeling in the hands and fingers, and pain in the hand, wrist, and forearm. Some women may also experience pain in the elbow, arm, shoulder, and neck. Carpal tunnel syndrome can occur in one or both hands, but it is more likely in your dominant hand because you use it more. Unfortunately, carpal tunnel can also cause pain at night, which can wake you up. It can also be more painful in the morning when you wake up. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about diagnosing carpal tunnel syndrome. If you think you have carpal tunnel syndrome, it's important to tell your healthcare provider so they can examine you. There are 3 simple tests your provider may perform to determine if you have carpal tunnel syndrome. The first test is called Durkin's compression test. In this test, your provider will press down on the median nerve to see if you have a pain or tingling sensation. The second test is Tinel's test, where your doctor will tap lightly on the nerve to see if you experience tingling in your fingers. The final test is Phelan's test. For this test, your provider will hold up your forearm bent at the elbow. You will be asked to relax and let your wrist flex naturally down by gravity. You will then press the back of your hands together to see if you have a burning, tingling sensation or numbness in your hands or fingers. If your symptoms do not resolve after birth, your provider may order some additional testing, including x-rays, ultrasound, a nerve conduction test called electromyography or EMG, and possibly an MRI. For most women, the symptoms of carpal tunnel syndrome are mild and no specific treatment is needed. If the carpal tunnel is more serious, there are strategies your provider may suggest, including avoiding any repetitive movements that may be making symptoms worse, taking breaks often, especially at work if you type or write a lot, taking breaks when using equipment that vibrates, a keyboard rest to support your wrists, alternating the use of hot and cold to the area, massaging the area, elevating arms to drain fluid away from the area and decrease swelling, taking Tylenol for pain, acupuncture, yoga, finger and hand strengthening exercises, and physical therapy. Your provider may also recommend that you wear a wrist splint, which is a brace that keeps your wrist in a neutral position. This is especially helpful at night while you are sleeping to reduce pain when you are asleep or wake up. In severe cases, your provider may inject a steroid medication directly into the carpal tunnel area, which can reduce swelling and pain. If your case is severe, or if it remains unresolved after delivery, your provider may refer you to a neurologist. This is a physician who specializes in nerves and the brain. You may also be referred to an orthopedist, which is a physician that specializes in bones and muscles. After examining you and performing additional tests, your physician may recommend additional treatments. These include using anti-inflammatory medications, including Motrin or Advil, which can help reduce swelling as well as alleviate pain, using diuretics or water pills, which can help remove extra fluid in the body by causing you to urinate more, steroid injections, physical therapy, occupational therapy, and rarely surgery may be recommended. Don't be surprised if your doctor takes a wait-and-see approach. Carpal tunnel syndrome may resolve given enough time following your delivery. Carpal tunnel syndrome can also begin while breastfeeding. This happens because you may flex your wrists a lot while feeding your baby. If this happens, your provider will probably recommend the wrist braces to help you keep your wrists in a neutral position. Breastfeeding pillows can help support and position your baby, which assists in relieving your wrist pain. You should rest your wrists as much as possible in between feedings. Water pills and steroid injections may also be necessary and should be safe for breastfeeding. Luckily, the carpal tunnel syndrome should resolve as soon as you are done breastfeeding your baby. Carpal tunnel syndrome can be an annoying and sometimes painful condition. I hope this has explained what the symptoms are and how to treat carpal tunnel syndrome should you develop it. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.